You're listening to Health Professional Radio. My name is Wayne Bucklar, and today I'm joined by Gary Sillet. Gary's the Director of Pillars of Strength and joins me from Sydney in Australia. Gary, welcome to Health Professional Radio.
Thanks for having me, Wayne.
Now, Gary, Pillars of Strength is not a name that immediately tells me what you do. Can you fill in for us a little bit about what it is that Pillars of Strength does and what geographical area you service?
Yeah, so Pillars of Strength was established in 2010 after the loss of my son after 2 days in the NICU, the neonatal intensive care unit. And we provide timeout and support for bereaved dads. And we also provide in-hospital support through accommodation at one of the hospitals in Sydney, a food and fuel program for families that are coming up to the NICU in a couple of hospitals in Sydney, and other timeout opportunities. So dads can reconnect with their mates and support themselves in some way, as well as also being able to reduce some of that stress and burden in a significant issues of time.
Now, this is not a rare circumstance, I gather, for parents of children to have children in distressing medical circumstances. No,
it's like on average there's about 3,000 stillbirths, neonatal infant loss every year, and then there's about 44,000 children who are being put into the neonatal intensive care unit or in special care on annually within Australia. It's quite significant if you think that every child has a mother and a father that may or may not be involved with them over the time. So there's a huge gap and a huge need for support, which we're trying to fill that small aspect of it.
And you focused particularly on dads. Do you find there are different needs amongst mums and dads?
Yeah, one of the main reasons is that I've actually experienced the loss myself. I had wonderful care and support for my wife and my child while they were in hospital. However, once we actually had the situation, we looked for different support programs that were available for men, and in general they were really targeted towards the mums, and very little was available directly engaged for the dads. Dads stereotypically, and men in general stereotypically, don't ask for help. So in some of our programs we look at it in a different way. So we're providing that informal peer support program, that informal support need, and getting the dad to actually ask for help without feeling like he is asking.
Now, I see on your website that you say you're not a counselling service.
Yes, well, one of the things, there are a number of counselling services and there are a number of professional counsellors across Australia, and we are not a counselling service, we're not a support group. As I mentioned, we're an informal peer support network. We provide timeout opportunities for a dad to reconnect with their family, friends, their support network. It's integrally important. One of the first things that actually leaves from the dads and from people who have either suffered a significant loss in the child space or actually have someone in the hospital is that their family and friends either can connect with them really well or they disappear because they are not sure how to actually engage with them. Dads in particular find that really difficult because men stereotypically don't ask for help. That's why we're focused in that space. We don't do any counselling. There are significant services and wonderful services out there. We actually are there to actually meet that unmet need. We're there to complement other services and to provide that support mechanism so they can actually reconnect with their support network.
I'm in conversation today with Gary Sillet, who's Chairman of Pillars of Strength, and we've been talking about the role that Pillars of Strength plays in supporting fathers whose children have either gone through a process of medical misadventure, that is, they're in neonatal intensive care units, or perhaps babies that are stillborn, or who have lost their fight for life. Gary, is it an Australian-wide service?
We're about to roll out it across the East Coast, so in Townsville, Queensland, Brisbane, New South Wales, ACT, Riverina, Newcastle and Victoria from early April. We've been operating for the last 4.5 years, close to 5 years in the New South Wales ACT area, but this year we're actually rolling out a sort of the East Coast program, which is a big step for us.
And Gary, it's a not-for-profit, I understand. How are you funded?
Purely by donations and some wonderful support from different organisations. So With our timeout program, which we provide dads with the opportunity to meet other dads in an informal environment by going to a sporting event or an activity. So we play cricket on the SCG. We take them to the football or to a comedy night, and most of those tickets are actually donated. And we've had some wonderful support from various donors to actually also allow us to facilitate what we do. So we run an accommodation program next to Royal North Shore for regional families while their child is in the NICU. And over the last, since we've actually had that established, it's saved the families who pay on average $150 a night about $90,000 in accommodation costs, which they could or could not afford. Some people have been staying in there for up to 3 days to 3 months. We usually have an average stay of about 4 weeks. And if you add that up, that's quite a significant burden, which we're reducing the stress for, so they can just focus on the baby's wealth and support, as well as supporting their partner.
Now, Gary, most of our audience are clinicians of one kind or another. We get everyone across the clinical spectrum, I guess, in both acute care and hospitals, and we get a lot of people in aged care as well. What's the takeaway message that you'd like them to hear from you today?
Probably the key thing is that directly or indirectly, or have someone that may have been affected. One of the challenges is there is a lack of support services for men in general, and this service is available for men across the East Coast. So if you know someone who has actually been impacted by a stillbirth, a neonatal loss or an infant loss, please direct them to our organisation, Pillars of Strength. We aren't the answer for everyone, but at least we can actually direct them to various support groups or counselling services if our service may not be there. We actually consider ourselves to do 3 things. We provide timeout opportunities, which allows dads to reconnect with their mates or to connect with other dads who have been through a similar situation. Our hospital service, providing accommodation, food and fuel program, and other aspects of it, or an information conduit, so we can actually give them unbiased information about other services that they can access.
Gary, in every endeavour, in every occupation, there are misconceptions that keep people awake at night. What's the biggest misconception you found in the work you're doing?
I think the biggest misconception is that dads don't need support. Men in general are very stoic, and I think that's the way that we've been brought up to be. The roles predominantly to support the partner both emotionally and physically, and to be the pillar of strength for the mother, friend and family and friends. One of the challenges within this is that dads want to be treated normally, and they want the support from their mates, their families and others. They want acknowledgement. However, the challenge is being connected or contacted, or actually ability for someone to actually ask them to do something normal, and that's where Pillars comes in. Well,
hopefully, Gary, today we can help dispel that misconception just a little bit amongst our audience. Now, I understand the best place for people to get hold of you is at the website, pillarsofstrength.com.au.
Yes, that's right.
I do appreciate your time today, Gary. Gary's the chairman of Pillars of Strength, and if you've just missed my conversation, the good news is we have a transcript on our website. We also have available to you an audio archive on both YouTube and SoundCloud, and you can find the links to all of those resources at www.hpr.fm. You've been listening to Health Professional Radio. My name is Wayne Bucklar.